Hi, Luis.
The Britannica Encyclopedia defines suicide as the act of intentionally taking one's own life. The act itself is both condemned and yet applauded in many different societies and religions. Today, it's considered something that is taboo or something we just don't talk about. Many patients who are seeking doctor-assisted suicide are only seen as selfish. But imagine for a moment if your loved one was in a terrible car wreck. The only thing keeping them alive was a ventilator breathing for them. If they had a living will and wished to not be alive just because of the machine, you would honor their wishes and pull the plug, so to speak. Now what if it was terminal brain cancer instead of a car wreck? If they chose to stop all treatments, again, you would honor their wishes. But what if their wish was to end their life with dignity when the last of the good days were gone? To end their life with dignity before the pain and suffering became so unbearable and overwhelming that the only thing they wished for was death. Would you understand and accept their wishes then? Or would you only see them as selfish? Or would you see that they are not wanting to put you, their family, through the pain and suffering of seeing them decline so rapidly? Today I will explain why I advocate for doctor-assisted suicide and why I believe you should too. The question many people ask is, who in their right mind would advocate for doctor-assisted suicide? Well, the answer is just that, anyone in their right mind. Previously working in healthcare, I can assure you that almost every terminally ill patient I cared for would pray every night for God to end not only their pain and suffering, but the pain and suffering that they feel they are causing their families. Too often, these patients feel guilty for making their loved ones see them that way, or oftentimes their family has to help care for them. That in itself pains them more than you will ever know. Have you ever had to watch a loved one lie in a bed in pain because of a terminal illness, just waiting for death to come and take them? I have, and I hope it's something my future family will never have to see. According to healthresearchfunding.org, over 65% of all white Americans would opt for the chance to end all life-sustaining treatments if they were diagnosed with a terminal illness. This is acceptable in society's eyes today. It is normal to stop treatment if it is deemed that it will do no good. But how is that so different from doctor-assisted suicide? You are essentially ending your life sooner because you are not taking the treatment you are prescribed. Now let's look at the legal side of things. Doctor-assisted suicide is only legal in 5 states in the United States. That is a mere 10% of the country, which means unless you live in this 10%, it is illegal for you to end your life, even with the assistance of a doctor with a prescription. Several smaller European countries, including Switzerland, the Netherlands, and Luxembourg, to name a few, have legalized doctor-assisted suicide. You must be a citizen of that country in order to receive these benefits, with Switzerland being the only exception. They do allow foreigners to take a form of residency to get doctor-assisted suicide if they are deemed terminally ill. I believe that at the end of life, a terminally ill patient should have the right to choose how they die, whether it be by doctor-assisted suicide or if they should pass on naturally. If we can choose to forego life-sustaining treatments such as chemo and radiation, why can't we choose our own end-of-life care? Why can't we choose how we die? Before disease and terminal illness take over our bodies. Dr. Kevorkian was a firm advocate and believer of doctor-assisted suicide. In the many years that he was a doctor and pathologist, he has claimed to assist over 100 patients with ending their lives with dignity. This gave him the nickname of Dr. Death in the medical community. He even invented 2 machines to help assist patients in their lives. One of them should sound pretty familiar to you. It consists of 3 IV bottles hooked up in succession to each other. The first one containing a simple saline solution. The second, a high dose of painkillers. And the third, a lethal amount of potassium chloride. Sounds very familiar to what we use in our prison systems, the lethal injection combination. He called this machine Thanatron, which translates to machine of death in Greek. His second machine was much simpler. It was a gas mask the patient would wear and delivered pure carbon monoxide to the patient. Dr. Kevorkian was finally arrested, charged, and convicted of second-degree murder for helping a patient assist in his suicide. The patient's name was made famous by this case. His name was Thomas Yoke. Dr. Kevorkian was sentenced to serve 25 years in a federal penitentiary. He was released after 8 years on good behavior. Again, showing that we have the power to choose our treatments or not to have treatments, but we don't have the power to choose our end-of-life care. If you look at it from my perspective, doctor-assisted suicide isn't murder. It is a treatment for those who are terminally ill. It is a way to choose not only how much pain and suffering you must go through, but how much pain and suffering your family must endure alongside with you. It's a way to keep the good days and not have to suffer through the bad. I personally hope, not only for my sake, but my future family's sake, that if I am ever diagnosed with a terminal illness, doctor-assisted suicide has been made legal. I wish my family never to see me suffering or lying in a bed because it is illegal for me to end my pain. I have watched families struggle with the pain of a loved one's illness, and it's something I hope many people will not have to see in the future. After all, how can we truly call ourselves the land of the free if we're not even free to choose our own end-of-life care?